Hey guys, Dr. Dave here. Have you ever had a sore neck, shoulder, arm, back, or hamstring while playing pool? I sure have. With me today are sports and occupational therapists Brad Ott and Kevin Rhodes to give us some advice and share some expertise related to common pool ailments.
My team at Rebound Sports and Physical Therapy has spent over 25 years diagnosing and treating overuse injuries of almost every sport you can think of.
And while Brad tends to focus on back, neck, and pelvis issues, I specialize in shoulder, elbow, wrist, and hand issues.
This is part of a 3-video series covering the top 10 physical ailments pool players experience. This part covers neck, back, and core issues. A traditional closed pool stance, where you twist and bend your neck a lot to get into the shooting position, can often lead to neck tightness and pain.
In this position, his head is slightly side bent and rotated, which means that the muscles of his left shoulder and his neck are going to be in a shortened or tightened position. Also, he's got, with his spine, we're going to have some rotation into the spinal joints, which is going to put some pressure there as well.
One thing you can do to help prevent this ailment is to use more of an open stance and bend more in the knees instead of at the waist.
Great. So what we can see here is he is much more neutral through his neck, much less tension through the left neck, probably less tension in the neck joint. So I think that could be a great solution.
Posture during non-pool activities can also have a big effect.
When you're addressing the keyboard, you can see here Dave's neck is forward flexed, bent forward, which strains a lot of these tissues down here. If we can reduce the strain at work and home, we can reduce the strain in the pool game. Now here, one remedy that we can do is we can raise the monitor to keep Dave's neck in a more neutral position where he's got that head back and reducing the strain of the musculature up here.
If you have neck tightness and discomfort, there are several stretches you can do to help.
Dave, go ahead and put your fingers on your chin, and he's going to do what's called a chin tuck and guide your head straight back, tuck your chin in, and try and get your ears behind your shoulders. Eyes are staying level. Hold that for 2 seconds, let it come back out. Good, and go right back in. We should do 10 reps of that, and I would say 2 or 3 times a day to interrupt your posture at work. So another useful stretch for this left neck is what we call a side bending stretch. We're going to have Dave lower his left shoulder, almost reaching to the chair. He could hold the chair. He's going to gently tip his head to the right, and we're going to get a nice stretch right through this muscle through here. If he wants to get a little bit more stretch, take the hand up over the head, apply a gentle overpressure to the side. Should get a nice stretch in here. Another useful stretch for the neck and the muscles in the upper shoulder is what's called a turn and tuck. So we're going to have Dave turn 45 degrees to the right. He's going to tuck down and look at his right hip. Left shoulder down. Great. And if he wants a little bit more of a stretch, take the hand up over the head and he's going to pull down and forward. This stretch should be a little bit more to the back side of the neck and shoulder.
Another issue with a traditional closed pool stance is asymmetrical hip twisting, which can cause muscle tightness and discomfort anywhere on one side of your body.
All right, in this closed stance, one of the most significant things here is that he is in an asymmetrical pelvis position, so he is rotated to his right. His belt buckle is facing more toward the camera, and that potentially can cause a big issue with malalignment of the pelvis and can contribute to a lot of low back issues.
A more open stance can help a lot to limit issues caused by hip twisting. If you want to learn how to find your personal best stance, see the stance advice link in the video description.
Okay, this is a much more neutral position. He's got more knee bend, his pelvis is not rotated to the right quite as significantly, and he looks a lot better through the low back position. Here we've got the anatomical model of the pelvis. These 2 sockets right here, or indentations, are the hip sockets. We've got a right pelvic bone, a left pelvic bone, and then we've got our tailbone or sacrum right here. The position Dave is in when he is in his traditional stance, this is what actually happens to the pelvis. His left side is rotating forward, right side is rotating back, and you'll see right in here the amount of torque that's put in. One of the big issues is your sport is fundamentally asymmetrical. So you are going to get into positions where we're torqued, kind of like a bent car frame. One of the strategies we recommend is doing corrective exercises that essentially pull you back the other way and use your muscles to reposition this pelvis back to neutral.
Fatigue and tightness in the lower back muscles is very much related to hip alignment issues. Here's a good stretch to help deal with that.
So one of the biggest issues with prolonged time on your feet is that your back's just going to get fatigued. We tend to have more of an anterior pelvic tilt with a little more arch on our back, and that prolonged time fatigues those back muscles and they get tight and tense. This is my number one go-to position for you to recover from. It's called a 90-90 position. So Dave's here on the floor, his hips are bent at 90 degrees, his knees are bent at 90 degrees. He could have his feet on a chair, they could be up on an ottoman, a coffee table, anything works. Find a pillow, roll it up, put it between your knees. We're in this position. Take some nice big breaths in through your nose, out through your mouth. As you exhale, long and slow with that exhale, feel your ribs going down in the front and your lower back flattening. Next, on the exhale, I want Dave to dig his heels into the bench and do a pelvic tilt. He's going to lift just his tailbone up in the air. Low back should flatten. Take 4 or 5 breaths. Full exhales. Feel that back melt into the floor. Great exercise to decompress your back.
Here's a stretch that can help deal with hip alignment issues directly.
Here's a great corrective exercise that basically puts you in the opposite position that you're in with a lot of your shots. So Dave's going to put his right foot in front. Remember, natural stance closed is right foot back.
Yeah.
Yep. Okay, he's going to take his right hand onto his left knee, put his hand on his hip. I want the back slightly rounded, so we call that tucking the tail. He's going to shift this left hip back and slightly toward me, and what we're after here is a nice stretch in his left outer hip. This is telling his nervous system that we're going to overcorrect him to the other way and get him out of that pattern that can lead to a lot of trouble.
How we stand when not playing can also affect muscle fatigue and tension in our lower back.
Another thing I want you to start paying attention to is when you are not involved directly in the match. Here's Dave relaxed, and he's standing in the same pattern that's giving us problems. His pelvis is rotated to the right. All of his weight is on his right leg. Start paying attention to that. What he can do to correct this is shift his feet. We're going to go left foot back, right foot in front, and I want him to get his weight on his left heel so that we've got this pelvis over here.
Here's a stretch that can help with back tightness and hip alignment issues.
As Dave's standing a long time, he's going to start to get a little sway back here. That's going to tighten up the low back muscles. Here's our remedy again. Hands on the table. That rounds his back. Tuck your tail. We're opening up his back, telling these back muscles to turn off. Right foot in front. We're going to shift back into the left hip with a slight bend in the knee. Try and feel a nice stretch right out here. Back is rounded. Great thing to do. Take 4 or 5 breaths. Repeat that like 3 to 5 reps. It's a great way to interrupt that.
A low pull stance, especially when playing for many hours straight, can fatigue and strain the lower back. One way to create some relief, just as with the hip twisting issue, is to use a more open stance with more knee bend and less bending at the waist. Back problems can have many causes and a wide range of treatments, but here are some general stretches that might help with typical pool playing back ailments.
Okay, with lower back pain, there are a number of things that can be causing that pain. It could be muscular tension, it could be intervertebral disc issues, sacroiliac joint pain. But to give you a few things to just try at home as a self-treatment strategy, we're going to show a couple here. So we've got a 3-foot long foam roller here. Dave, let's get you on the foam roller on your back. So he's going to have that foam roller right at the bottom of the tailbone, and we want his head to hit the top of the foam roller. When you go on this position, the first thing I want you to notice is whether or not your lower back seems arched away from the foam roller. That's a sign of a lot of lower back tension. With Dave, we can see that his ribs are kind of up in the air. So what we'll start with is maybe about a minute of breathing in through the nose, out through the mouth, and I want you to focus on feeling these ribs go down, Navel falling toward the floor. Again, let's watch his ribs here. That's a spinal decompression, and his body weight on the foam roller is assisting with that. Okay? So let's say that was a minute or so of just breathing, trying to get that tension out of the back. We can add some stretch to the front of the chest wall because of the rounded nature of playing pool and matches. We're going to take the arms out into a chest stretch position, and you can find an angle here. It could be a little higher, a little lower, and you let those arms just sink down. Feel the stretch across the front of the chest. And again, Dave, we're going to go right back to the breathing. I would hold this for maybe 30 seconds, give your arms a break, and do that 3 times. That's great.
Tight muscles in the hips can also lead to lower back pain, so it is important to keep them from tensing up.
Another option for some generalized low back pain is to stretch out your deep hip rotators. Those are muscles deep underneath the hip that can get real tight with prolonged standing and some of the postures that you're playing pool in. So to stretch his right hip, we're going to have Dave grab his right knee with both hands. He's going to pull up and across to his left shoulder to just take up the slack. We're going to take this leg over and now grab the ankle and apply a little bit of a twist while we keep this knee up and across. He should feel a nice stretch in his deep right buttock area. Low back should stay flat on the floor, no twisting. I'd hold this for at least 30 seconds. You might do it a couple times on both sides. Okay, another view of the same stretch we just did is we're going to have Dave pull that knee up, across toward his left shoulder. He's taking up the slack. He's starting to feel a nice stretch here. Low back has to stay flat on the floor, no twisting. We take this leg up and over. He grabs with his hand and applies just a gentle twist. Again, should be felt as a deep hip buttock stretch.
A traditional pool stance can also lead to hamstring tightness, soreness, and discomfort.
This leg is elongated, and I could see why this would give you some stress to the hamstring. It's on stretch, and it's going to take a lot more tension.
As we saw before, bending more with your knees and less at the waist can help, especially if you are tall like me. Here are some stretches that can help with hamstring tightness.
These are a couple basic stretches. One is more passive, and the other is going to be more active. So for the passive stretch, we're going to have Dave grab his right leg. He's going to bring it to about 90 degrees so the thigh is vertical. Hands go behind. Okay. Neck and back relaxed. We're going to extend the leg up until you feel tension in the belly of the hamstring. Some of you are going to be way down here. Other people might be up higher because you've got a little better flexibility. You're going to hold that for 20 to 30 seconds, and during the last 5 seconds, I'd like to have Dave pull his toes down toward his nose and then point up toward the ceiling. Down toward his nose, we'll feel stretch through here. Up toward the ceiling, we're even loosening up some of the tissue into the lower leg along with the hamstring stretch. Now here's where it gets active. We're going to have him take his opposite hand and start right here. A breath in through the nose, and on exhale, I want him to curl up and use these abs. Really draw those abs in. Take another breath in. Exhale, reach a little higher. Abs are on. Good. One more breath. And a good reach. So there's 3 breaths with 3 reaches. Now, with both the active and the passive stretch, even if it's only tight or tender on one side, I would recommend you do both.
Be sure to watch the other 2 videos in the series for help with other common pool player ailments. We hope the advice and demonstrations help you experience less discomfort and allow you to play our great game for many years to come. If you're having trouble with any of the ailments, you can do the pertinent exercises and stretches as a warm-up routine before playing. You can also do some of them when playing while waiting for your turn at the table.
Okay, a couple things to remember. One size does not fit all with these stretches and exercises, but give them a try, see how your body responds, be consistent with them, and see if it can help prolong your career, improve your play, and make your body feel better.
Rebound Sports and Physical Therapy has over 25 years of experience helping athletes in many different sports. If you want individualized help with the pool ailment, or for more information, visit the Rebound link in the video description. And as always, good luck with your game from Dr. Dave.